they don't interpret pain as danger. They interpret pain as information. They're curious about it. So if I move that, they're like, oh, interesting. What's happening there? The people that do really well are more curious and they're not afraid of pain. They just think pain is the information telling them where they're at and what's happening. They have a low fear of movement.
Hey everyone, Derek Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it.
Good day, my friends. Welcome to another episode of the Pain and Performance Podcast. I'm your host, Dr. Derek Hines. And on this show, we try to take the latest research, the latest developments in technology and behavioral science and kind of integrate all those to give you little bite-sized chunks of information in between our long-form interviews with experts so that you have the information and the motivation at times to improve your health, improve your healing, improve your life. One of the questions that I got a lot over the last couple of weeks is, what do your patients who heal really well do versus the ones who don't, regardless of program? So obviously, if people are doing regenerative therapy versus basic treatment, we're going to see quite different results in those. But if everything's being equal and you have somebody who heals really well versus someone who doesn't, what was the difference? And this kind of sent me down a little research rabbit hole of going back through a bunch of patient cases and trying to kind of tweeze out what the things were that made a difference and talking to our different doctors and saying, what seems to make a difference to you? And we came up with a few categories that you can use to improve your outcomes if you are going through regenerative therapy, physical therapy, treatment, transformation of some sort. So I'm going to break those down for you and we'll talk a little bit about why they tend to happen. So this is the list of what patients who recover really well do that those who don't seem to struggle with. The first one is sleep. Our body repairs and heals with sleep. I know pain can disrupt that, but when we looked at all of the cases, the people who tended to recover faster and do well figured out a way to get back to good sleep quickly. So I had this discussion with a woman yesterday who's recovering from a meniscus tear. She was really struggling for the first 2 weeks to figure out a method to get good sleep. And finally, we have a perfect little scenario. We were looking at her sleep tracker yesterday. She is getting great sleep again. And guess what? In the last 7 days, she's like, my knee feels better than it has. Now, that's the culmination of this, but sleep matters. So some of this is just figuring out the right combination of things that is usually inflammation, position, and then components that help with sleep. So in this case, we integrated glutathione before bed, ice before bed, calm that inflammation down. She started taking a combination of magnesium and then a cannabis and THC combination that was right at about 1-to-1 to reduce inflammation and calm nerve pain. And that combination of things has really shot her deep sleep up dramatically. And her body's recovering better because of it. Figuring out what things need to be done for you to sleep well matters. And our patients that do that recover better than our patients that don't. The next part is movement. Patients that take an injury and modify their movement so they don't hurt, but they don't stop moving, always recover faster, better, and deeper than the patients that let the pain completely disrupt movement. Anytime patients ask me, and if you're listening to this, you probably heard me say this, ask me like, hey, should I do this? It's always like, do something to keep your routine going. So if it's going to the gym, okay, and you got a leg injury, maybe on leg day, you're going and you're stretching and you're doing some version of pain-free cardio to keep movement. And then you're doing some isometrics. Like, what can we do pain-free that doesn't bother the tissue? And then you keep your arm days and your core days all kind of going, maybe with slight modifications. But we have to keep movement. If we tell our body we're going to continue moving, our body's going to figure out ways to continue to problem solve and put healing in there. And we're going to recover faster. You're getting blood flow. You're continuing to do that activity session. If you remember back to the episode that we had on the components that you need for tissue regeneration, you have to have that activity level in there. So movement is vital. One thing I tell everyone is to track your steps. When you are recovering, start tracking your steps. Most of our devices do it. There's really cheap step trackers that can help you do this. So start tracking your steps, because during this time, you need to know that you're moving enough throughout the day, and we can trick ourselves. I'd say most people come in and I ask them how much they're walking, and they're like, oh, 8 to 10,000 steps. And we start tracking it, and it's like 3 to 5. They overestimate by 100% very often. This is not a slight at anybody. Very often we see that happen. So make sure you're moving. The other part is, when we really look at people, even with really severe injuries, they don't over focus on their symptoms. And there's a lot of research that backs this up. There was a study done in one of the major medical groups. I want to say it was Kaiser Permanente, but I could be wrong about that, where they made them fill out a pain questionnaire every day. And at the end of the study, pain went from like an average of like a 1 out of 10 to a 3 out of 10, just because every day they were focused on, where is my pain? What's the quality of my pain? And their brain's going to start answering that question. So when we really look at people who recover very well, they don't catastrophize the pain thinking like, I'm always thinking about, what was it? What did I do? In fact, in the office, we used to have patients fill out a pain journal, and we've completely stopped that because of this thing that creates this over focus on the symptoms. And then your brain starts to kind of try to find those symptoms. So we're aware of it, but we don't over focus on it. And this is always a challenge with us at the office. We want to talk to you about progress more than we want to talk about, like, go back. When did it hurt? How did it hurt? What did you do? Your brain will start answering that question if you overdo it. So if you find yourself focused on that, one of the next bullets that we see in our patients who do really well is that they focus on progress instead of pain. So instead of constantly being like, oh, does that hurt? How does it feel? What's happening? They start training their brain to look for, what was I able to do that I couldn't do before? What feels better? What feels stronger? What movement's getting better? And now your brain starts to get conditioned to look for those things, and it gets rewarded for them when you notice it, and then it tries to do more and more of it. There's a very strong mind-body connection here. And if we can lean into that, we can definitely use that to improve. This is not woo-woo. This is in our science that says if you get better brain-body connection, you're going to heal faster, you're going to move better, you're going to function better. So focus on progress more than you focus on pain. The other thing that is always challenging for any transformation is consistency. In our patients who do really well, they are quite consistent in their routines, in their treatment. They're consistent in their programming. What do they need to do? They tend not to miss those things very often. Of course, if they get sick or they have an issue, they do. But by and large, they are much more consistent. And when we see people who are inconsistent in treatment, in programming, in exercise, in diet, in sleep, all of those things start to inhibit good, steady progress in healing. Healing is not like a one-time endeavor. It's your body every day getting the signal, the resources, the blood flow, and all of that accumulates and compounds into this awesome regeneration. Your body's incredible. We have to be consistent and consistently tell it that it needs to heal basically every day over whatever recovery period we are looking at, depending on how much tissue is involved. So if the more consistent we are with what we know needs to happen for us to repair, the better we're going to get outcomes. And then the last one that's a little bit back on the cognitive side is they don't interpret pain as danger. They interpret pain as information. They're curious about it. So if I move that, they're like, oh, interesting. What's happening there? It's just like my body is trying to warn me that something's going on there. It's not danger. It doesn't make me afraid to move. And there's, again, really good studies that if we have high fear of movement, that we have worse outcomes on every recovery scale that you can, regardless of treatment, surgery, stem cells, any of that stuff. High fear of movement equals poor outcomes. And so in these situations, there's some digging that has to happen if you're trying to correct each of these, especially if it's on that level. If it's on the I'm afraid to move because of this. I think the only reliable stuff that I've seen for this is like, digging into psychology, journaling, and really talk therapy or cognitive behavioral therapy. If you have a high fear of movement, it is not wasted time or energy or money to go and find good cognitive behavioral therapy for movement, to do a little bit of journaling of reinforcement that movement's good. Movement helps heal my body. Movement puts me in a better position. Movement nourishes me, and just programming your focus to say movement is safe. My body's meant to move, and starting to drill that in. And if you need to, getting some therapy to talk this out. Why am I afraid? When did it start? If I am like kind of over focused on those symptoms, how do I reprogram that? That is a very big part of healing. And when we look at all of our patients, all things being equal, demographics, the people that do really well are more curious, and they're not afraid of pain. They just think pain is the information telling them where they're at and what's happening. They have a low fear of movement. And we can all get to these things. We can all improve our sleep. We can all move a little bit more, finding any way that you can to move more. We can all kind of make sure that we're not constantly focused on our symptoms. If we start catching ourselves, become aware of it, and kind of get back and focused on life, right? We can all focus more on progress than pain and start training our brain to do that. And then we can start to program ourselves to know that movement's medicine. Movement is helpful. And all of these things, if I put it all under one thing, I think my patients that do really well and heal great almost treat themselves and their health as a little bit of an experiment. It's kind of fun to go through these things to them. They're curious about it. What different components can I check and achieve in different ways? And I'm just my own experiment. I'm going to try something and it's going to be successful, or I'm going to learn something. There is no failure with anything. It's always like I'm trying it as an experiment. If it's improving things, great. I might tweak it. If it doesn't, then I learned that might be something that is helpful for somebody else or in another situation, but not for this one. And they kind of think of the recovery process as an experiment. That's kind of all of these things. And when I look at patients who recovered from severe nerve injuries, disc herniations, rotator cuff tears, meniscus tears, all these things that we used to think, oh, you need surgery. People heal from these all the time in our office. The ones that do that at a very, very high level tend to kind of treat the process as an experiment, and they start playing with these levers of how can I improve sleep? How can I move a little more and not bother it and inflame it? How can I focus more on the progress that I'm making and a little less on the pain? Can I make sure that I am kind of finding ways to push it and progress a little bit every day? So they kind of put all those things with curiosity of how the experiment's going. So I hope that helps you. When we look at this, it's a weird thing to talk about, is like, what do people do better? Because obviously every situation is different. I do find when people come to our office from other places that often if they failed initially, were we checking all of the 6 regenerative requirements? Very often somebody missed one of those. But if we're hitting all 6 of those regenerative requirements, then these really come into play in recovery. Are we doing all of the things to support that process? So I hope that helps you. If you're going through this and you have questions or you want to dig into a little bit more of this information, let me know. I'd love to talk to you. I'd love to talk about it. And remember, do one thing today to get a little bit healthier. Have a great day, everybody.